Good evening, Malden. And we are back again with another COVID update. Thanks to our guests, Chris Webb, our health director, and we have Christian Lanphere, a regular from Cambridge Health Alliance. Before we begin, I just want to, as I always do, thank UMA, Urban Media Arts, formerly known as Malden Access Television, for being with us this evening. And we'll also be joined by Ron Cochran, our communications director, shortly. Special shout out to UMA because they have two events going tonight, one at 5 and one at 6. And so I asked them which one did they want to do. And of course, they said both. So we're going to end just a little bit early so we can get over to the superintendent's interview, which starts at 6. So it'll probably be 6:05 when we start that due to the crossover. But again, our guests, Mr. Webb and Mr. Lanphere, thought it important that we continue to stay in touch. Despite things seemingly getting better, we do not want to take a foot off the pedal. So we're going to have them make brief introductions. And then, of course, most importantly, we want to get to your questions, which I have some of those here tonight. And we'll see if more come in during the broadcast. So without further ado, let's go to Mr. Webb, our health director.
Hello, everyone. It's good to be back again. There's been a little bit of break, but we've been very busy vaccinating and testing, and things are going well. I think the mayor put it very well when he said it's getting better, but it's not quite there yet. We have a positivity rate right now of 2.53%, which puts us in the yellow category. And it's really the middle of the yellow category. I'd really like to see us get to green over the next 2 weeks, if at all possible. And to do that, we'd have to get down to less than 10, average less than 10 cases a day per 100,000. Right now, we're averaging about 18 cases a day. So that's a big number to overcome. And it's going to come down to our behavior, the way we behave around St. Patrick's Day. Spring break is a huge influencer. It will have some impact here, I believe. So if you've got kids out at spring break or headed to spring break, have them use an abundance of caution. It will be a super spreading event. There's no two ways about it. Okay. So I'm looking forward to the questions, and I hopefully have the answers.
And Chris, if someone wanted to contact you offline, what's the best phone number and email?
Best phone number is 781-397-7049. And my email is cwebb, W-E-B-B, @cityofmalden.org.
All right, over to you, Christian Lanphere.
Good evening, residents of Malden. My name is Christian Lanphere, and I am a hospital administrator and the emergency management director for the Cambridge Health Alliance system. I can't really repeat or stress enough what Chris said, that we're in a better place, but we can't let up the pedal, and we really got to keep going, at least until we can get many, many more people vaccinated. If we do want to look at another surge, we're heading in that direction by people taking off those masks, traveling frequently, going on spring break trips. These are things we really have to avoid until we can get a little bit more vaccine into people, and we can get this done for good. So lots of questions there still remain out there, but certainly I'm available at the hospital at 617-665-1000 or clanphere@challiance.org.
All right, very good. Now, typically, I have to say, in the middle of the screen, we would have Courtney Nickerson from the Board of Health, but she couldn't be here tonight. So on behalf of all of us, you missed tonight, Dr. Nickerson, and we hope to see you again at our next broadcast. So, Mr. Webb, the question of the day: after a person has been vaccinated, can they ever catch COVID-19 again? You're on mute, John.
Right now, the data isn't complete on that. If the vaccine works like in the same way that an influenza vaccine does, there's always going to be a slight chance that you will still contract the disease. I think they're hopeful with this RNA approach that they've overcome that, but I'm not sure that they have the data to be, putting it out there as a fact yet. I'm positive they don't have factual information yet.
Okay. And Christian, let's say while we wait for that information, after a person has been vaccinated, what are you hearing and seeing about how long it takes for it to kick in? I mean, we've heard different timelines. What do you think the
Yeah.
average
So
one is?
I think it's traditional with any vaccine, anywhere between 10 to 14 days is where the body gets immunity. However, because this is a 2-dose vaccine, people I think are often hearing these 94, 95%, which, really people should not really focus on those areas, but really it's after that second dose, 10 days to 14 days after that second dose, people should have a good, strong immunity against the coronavirus and some of the variants that we're well aware of at the moment.
And Christian, let's stay with you. So is the immunity good enough that people can start chucking their air purifiers and other things that they were using during the height of COVID-19?
There's still a lot out there we still don't know. I think that, there's still lots of work being done in the clinical trials, particularly around people who are vaccinated, may not getting sick, but could they risk passing it on to others? There is also the notion that there's still plenty of people out there who are still not protected against COVID, and so the best protection they have is the masks and other protective layers. So those measures all need to stay in place until we get herd immunity and enough people in the population are vaccinated that we can take these off permanently.
All right. Speaking of which, Mr. Webb, Johnson & Johnson, Moderna, Pfizer?
Which do we like best?
Right. What are you hearing?
Everybody asks me that, honestly.
Yeah.
And I tell everybody the same thing, whichever one you can get. And, there'll be a time later, probably, May, June, where you'll be able to choose. And there'll be enough vaccine of each type where, your lifestyle or your desire to have a higher level of, immunity based on the scientific data, you could choose. I would prefer that we all got Johnson & Johnson so that everybody only had to, be inconvenienced once, because it is a much easier vaccine for clinical staff to work with. It is a little more durable in as far as temperature controls and general use. I mean, you can't even shake a vial of Pfizer. You have to tip it. So there's no shaking. It's often, weird to watch nurses put the diluent in and then tip a bottle like this. So that you have to understand these things are very difficult to work with in a clinic, like a rush clinic setting. So a lot of work goes into the preset for that. So I'm always a big fan of Johnson for that reason. But for the average person right now in the vaccine supply system that exists today, you should take whichever one you can get.
Okay, let's stay with you, Mr. Webb. So I still remember Mr. Cochran in the State of the City address in the first section of the presentation, when he looked back over the past year. He had one slide in there that showed phase 1, phase 2, phase 3. When do you think we're going to start to get to phase 3 or I guess phase 2, right? We're just getting into phase 2.
We're actually going phase 3, step 2. That's where we are now.
No, in terms of the vaccination.
Oh, in terms of vaccine.
Yeah.
Yeah. We're basically in step 2. I think we're going to see that step 3, which is more of the general essential worker population. I am hopeful from what I've seen. I see a couple of reports saying vaccine amounts are going to surge in April, and then I see reports that say that can't possibly be true based on delivery systems in place now. So I am hopeful that that population will be late May at worst. That I think that would be, really disservice to those people if they didn't get to them by May, because everybody's going to start going on vacation, and these are the people, the backbone of our society. It's how people get things done. Grocery stores and gas stations and all these places where people need to have an abundance of workers so that their lives aren't interrupted. so I think it's really important. It will change the way we live our lives again in a noticeable way when those people are vaccinated, I believe.
All right, let's break away for a live caller. Let's go to the studio. I think we have Deb on the line. Or did I wear her out with my monologue? Deb? Hi, Deb. Yeah, I think Deb had enough. Deb, try to call back. I promise I'll go right to you as soon as you call back in, okay? Mr. Cochran, do we have anybody else? Because I just kept going. I apologize.
Yeah, you were on a roll there for sure.
Yeah. Yeah.
Yeah, I'd just like to get in really quick before we move forward that if you want to ask your questions, you can, of course, dial in 781-388-9394. That's the phone number directly into the UMA studio. And then, of course, if you want to message us on Facebook, we can take those messages and we'll ask your questions. But I'm happy to share a question that was submitted to us prior.
Let's do it.
Yeah, sure. Okay, so after a person has been vaccinated, when does the immunity actually kick in? And then how long does that immunity last?
Okay, hold that because Deb is back.
All right.
Let's hold that question. Deb?
Yeah, I'm here. Yes, I'm here. Hi. Hi.
Deb, are you
My
there,
question
Deb?
is, yeah, okay. My question is, with many seniors being vaccinated, any idea
Gonzo,
when
you
the
sure
senior
it's not a
center will
prank
reopen?
All right, why don't we get to Mr. Cochran's question? We'll start with Mr. Lanphere.
Well, so what we know is that the immunity really starts to take hold between 10 and 14 days after the first dose, which gives you about 55 to 58% protection. The second dose will give you the maximum protection that the manufacturer has demonstrated through their clinical trials. I think there's a lot still, I think we get a lot of questions. I'm sure, Chris, you get the same question about, is this going to last? Is this the only time we're going to have to get shots? And the answer is we just don't know. I think that once the first part of the clinical trials, the year trials probably are likely to, the first year will be done in June for the first group. I think that they'll know more about if a booster shot may be needed. Some predictions are that will probably likely happen anyway. But I think, there's still a lot of work that's being done at the clinical trial level to determine what those answers are.
Okay, Mr. Webb?
Yeah, I agree wholeheartedly that
Okay.
there just isn't enough data yet. And I don't want to use the word guinea pig, so I won't, but our acceptance of the virus through our bodies is being studied by any number of people. And someone asked me that today, actually, at the clinic, and they said is it 90 days? And I said to them, you should behave like it's 90 days. And what I mean by that is keep wearing your mask, keep washing hands, keep doing things to protect yourself from other people, because we just don't know, right? And you don't want to wear out your immunity by stressing your body by testing it out so early on, while there's still so many people out there that are positive. We have right now 6,048 positive cases in the city. That's known cases. So you still want to be very careful. You don't want to test your immunity until we know more.
Very good. Let's see, Mr. Lanphere. My parents get vaccinated. Can they now come over during the upcoming holidays, including Easter?
Well, so I think the CDC has come out with something this week, which I think has led to a bit of confusion. They are saying that it is safe for vaccinated parents to visit with unvaccinated children. I still think that protective measures should be taken. I haven't heard the comment that Chris made, but I love it. I think that people should behave like their immunity hasn't kicked in for 90 days. I think that's something I'm going to take back to our own organization. people really do need to behave like the body is still working to immunize you and not to stress the body. I just think it's critical. And I still think that everybody's different and not everybody is going to react the same. And I think it's important that people, continue to take all the measures that we've been doing the last year to sufficiently protect themselves.
Okay, Mr. Webb, when is the mask mandate going to be lifted?
Boy, if I had the answer to that, I'm a pretty popular guy now because I have vaccine, but if I knew the answer to that, I'd really be popular. If I were guessing, it will not happen until, probably people are going to cringe when I say this, but my guess is probably January for a couple of reasons, mainly because by then we should have a decent amount, if not half, at least half the population vaccinated by then, hopefully. And if that's the case, then you might see masks come off for those instances where you might be able to socially distance. I don't think you'll see that happen in stores or supermarkets until probably spring of next year.
Okay.
It's going to be a habit that we should keep, actually, too. I mean, let's look at the influenza this year. It's
right.
Non-existent, really. Our vaccination clinics were ghost towns, and for good reason, because there just wasn't enough influenza around to concern people. And that is an added bonus. 33,000 people die every year of influenza.
So Mr. Webb, could you see in the future where that actually happens in the fall and the winter? Will it be mandated, do you see? Or
I don't think it'll be mandated, but I think it will become part of good public policy and outreach to people to say, look, it worked, it works. Let's do it again. Let's keep people in work. Let's keep the economy going, especially when we're trying to recover our workforce. It's very important. And I think that most, people with large workforces will probably ask their workforce or mandate it that they wear masks during cold and flu season just to keep this, enough people in work. We've got to catch up. And the only way to catch up is to have a sufficient staff.
All right, let's go back down below to Mr. Cochran.
Well, we were going to do a follow-up. It's 2 questions ago, but I think it's worth asking. Same question on immunity, but for those that have immunity because they got COVID as opposed to those who got vaccinated. Same question.
Good question. Mr. Lanphere.
So one of the things that we've been looking at least in this, in the patient populations that we've been watching and observing over the last year, is that most people have had sufficient immunity, anywhere from 90 days to 120, 160, some 160 days. Again, everyone's a little different, but the CDC did push to hold off vaccinating people who had recently had COVID over the last 90 days because they had sufficient antibodies to protect them. And those were good public health measures to get as many people protected while the vaccine supplies improve over time. But I think there's something that's just as important. I think as we talk about, I think people should not worry too much about what type of manufacturer people should be looking at. All 3 of these vaccines are very, very good. The clinical data on all 3 of them are excellent, and we are now starting to vaccinate people who recently had COVID. And those studies have really been shown to be fantastic. I just think that the way these trials were conducted is just something I've never really seen before. They're excellent. I think that the work that's been done on them is excellent.
Yeah, good point, Mr. Lanphere. Let me jump over to Mr. Webb. I know it continues to be a trying time for us all, but when you step back, it is pretty remarkable that they've been able to pull this off within a year, is it not?
Yeah, I mean, honestly, when this started, when we were talking a year ago in March, and we were thinking, when will we have vaccine? I'm sure my answer was, we'll get our first doses in June, because we were looking at a truncated study period, but I didn't think it would be as truncated as it was. I gave them a year and a half, and they did it in under a year, which is remarkable, and it says a lot about the beauty of this was the manufacturer goes to a group of scientists in their employment and say, how can we do this faster? And it didn't take but 10 minutes of conversation to say, if we go with the RNA approach, it could change the way we do vaccine forever. And it didn't take a lot of conversation. They said, let's just do it then. And off they went. And kudos to them, because it's a big jump to do that. They could have failed. They could have failed miserably, but they didn't. And they stuck with it, and they invested their time, and they put the best people they had on it. I think we should be nothing but proud of that work.
Yeah.
Nothing but proud.
All right, Mr. Cochran, back to you.
And as a means of maybe encouraging on the vaccine for those that had COVID, there's been a rumor floating around, and somebody wanted to get clarification on it. And that is for those that are considered long haulers, continuing symptoms, that the vaccine can actually assist in easing some of those symptoms. Is that just, is that just floating around story, or is there any validity to that?
Still Lanphere.
So I have not heard that. I mean, we do have, we continue to see in our respiratory center, long haulers who we've encouraged to get vaccinated. I don't know enough about sort of what they're seeing in those clinics with regards to long haulers and how they're being managed.
Let me stay with you, Mr. Lanphere. Clear up too. I know Mr. Webb's talked about it in the past, but someone that is in getting care, they're not to get the shot until a certain period of time, or can you get it while you have it?
So one of the things that we are trying to do is we're trying to ensure that people feel better, that they don't have the symptoms, and I think this is important. And it's certainly early on where we wanted to make sure that the side effects that people were having were not related to COVID, and they were related more to the vaccine. But we still are not, we're vaccinating people relatively close after the incubation period of COVID, but they must be symptom-free. We are requiring that as a condition of getting vaccinated at the moment.
Same with you, Mr. Webb?
Yeah, I mean, that practice only makes sense because you don't want to confuse your outcome. My wife is actually recently diagnosed as a long hauler, and we're not going to go forward with the vaccination just yet because her symptoms are still so difficult to tell from anything else that if she got the vaccine, and I've had the second dose, and I suffered for a day. I don't think her system is ready to deal with that right now. So we're going to hold off just a little while longer until she's feeling a little bit better and is less symptomatic, and then we'll probably go forward.
All right. Back to you, Ron.
Side effects of the vaccine. It's been floated around. I think we can probably put the nail in this one. There's been plenty of stories, but it seems to be more clickbait than it is anything of concern. So maybe you guys can address what, if any, side effects have you seen from the vaccine?
Christian?
I think Moderna has got a stronger kick to it than we've seen with Pfizer and Johnson & Johnson. I think all of them have, one thing they all have in mind is they have the sore arm, the headache. Moderna, I think, tends to have a little more of the flu-like symptoms associated with it. I'm looking, to Chris to sort of see what, he's been experiencing in the community. But those symptoms tend to go away. For those who have had symptoms, they tend to go away within 24 hours.
Mr. Webb?
Yeah, what we're hearing at the clinics, from people we're seeing coming and going after their second dose, and we do ask people to give us a call, and some do. So what we've gotten so far is absolutely nothing, which is, they're very happy about. Then it starts with, I just had a headache. I spoke to a man today. He said he just had a headache. 45 minutes later, it was gone. He was fine. I, on the other hand, woke up, and by an hour and a half after I woke up, my knees started to hurt, my elbows started to hurt, my shoulders started to hurt. And then half an hour after that, I had a fever of 101, and that lasted probably 6 hours, and I was exhausted. I don't think I've ever been that tired in my life. Not physically exhausted, but just I could not stay awake. So I went to sleep, took my Tylenol, drank as much water as I could possibly put in me. And when I woke up the next morning, I felt like $1,000,000. I'm not kidding. It's not just a phrase. I got up and I felt good. But what we're hearing is generally you've got a 6 to 8, maybe 10-hour experience with flu-like symptoms. The trick that we're telling people is drink as much water before you get your second dose, drink as much water as you can tolerate after you get your second dose, and use Tylenol every 4 hours if you're having any real issues. Because mainly it starts with the pain in your shoulder. And that's not anything to sneeze at either. This vaccine is a little viscous, so it's going to expand in the muscle. So you're going to have a little bit of pain from it. But overall, you will recover. It may not feel like it, but you're only going to be sick for a little while. And it's amazing how it passes. It really is.
Chris, do you recommend people almost prepping for the shot by taking Tylenol ahead of time?
I don't think it would hurt. I just wouldn't. I think I would probably maybe 4 hours before my appointment, if I have the time, I would probably take some just so that I could take it 4 hours after my dose, because my arm's going to hurt. It's going to bother you 4 hours later, definitely.
Yeah.
I didn't notice it until I bumped into the wall at home, and wow, that was a wake up call for me. So yeah, I started pumping the Tylenol in the water. Water seems to be more of a help than even the Tylenol, believe it or not. Boston City Hospital is telling people to do 64 ounces of water after they vaccinate. And it just loosens, it fills your muscles with water and helps disperse the vaccine. So anything to spread it out is really what you want to do. And then of course, you're passing the byproduct of the virus and the vaccine working together through your urine as you go. So it helps a great deal.
Okay. Back to you, Mr. Cochran.
Yeah, and I think just to reinforce the thing that Chris, that I've always heard from you is that when, there are when people hear side effects, they tend to think of the big scary umbrella of, the fear mongering of things, that what the vaccine might do, of a nefarious, element and not actually helping you. But in reality, when you're feeling those symptoms, you've told me that means things are working. That means that you are actually getting an immune response that you need. So that whole thing you just described means thumbs up. May not feel great, but thumbs up, it's doing what it's supposed to do.
Yeah, I'd agree. And people shouldn't take it one way or the other. I mean, if you're feeling symptoms and they're strong, just means your body's putting up a good fight. It's moving through your system and your body's responding strongly. If you get nothing, it just means that you have good resistance already for whatever reason. You may have had COVID already and didn't know it. You may have been asymptomatic, and you may have already have built up some immunity, and then you get the shot and it adds to it. So you maybe just get the headache. Maybe you just get a little achy. And that just means your body doesn't need to work as hard. My body needed to work. I felt it for a good 6 straight hours. I was thinking, it feels like the flu coming on, but it passed. It did. And I had every expectation it would, and everybody should, because I don't know of anybody that's had a bad effect other than people who had been sick with COVID and get the long haul. But I haven't heard any information around vaccine causing those issues.
Okay. Another question that Mr. Cochran and I received was around the variants. So Mr. Lanphere, what is the latest with the variants? What do you see happening down the road here?
Well, so, I think one thing people should understand is that certainly with viruses, I mean, they're in survival mode. You are going to have variants. I'm actually shocked that, the variants are only starting to emerge now. I think that this is something that I would have predicted would have come sooner. And maybe there have been, we just didn't know it. But they have started. I think that all of the manufacturers are currently studying their vaccine against the variants that are known. The Brazilian, the South African, is the ones of concern at the moment. And there seems to be some good evidence that these vaccines are working. And, if there is anyone who may get the variant, the disease may be mild, that it will not be a severe disease that could require hospitalization. So I think that's all the more the important reason why people need to continue wearing masks until, herd immunity is not something that's just to local. It's, Boston is a world traveling city. And so, there needs to be enough immunity when people vaccinated across the world before things can really be let up. So, we're going to be in this for a little while, but I do think that there's hope that, people can sort of get back to normal, sooner than later.
Okay. Mr. Webb, as you can imagine, we're starting to get questions about Independence Day celebration, St. Rocco's Feast. Is it too early to say?
It really is. This vaccine rollout, or whatever you want to call distribution system, is I'm sure more work than I would want to do, but it's not to the level that we would expect. We keep in mind, we trained for this eventuality for the last 15 years, and we know that there was another method of vaccine distribution that hasn't been used. So it's interesting to see the direction that process has gone rather than what we've trained on. I don't know that the other system would have been any better, so I can't really be too critical about it, but I would have liked them to stay with it, because then we would have been a little more prepared for any of the issues that we've come into now. We don't have the same reporting channels that we would have under the plan system. So every issue that we have, instead of being pushed up the chain and collated with other issues and then addressed, really isn't happening. And that's frustrating. And I'm sure it's frustrating for everybody right now who's waiting for a dose.
Okay. Mr. Lanphere, you agree? Too early to talk about large scale celebrations?
Yeah, I think it's too early. And I just have to agree with Chris. We've been doing this for, for 15, 18 years. And the plans that have been developed all those years, have not been used. And there's another method. And I do think, it's an unfortunate thing. I agree. I'm not sure that it would have been better, but, people were much more prepared. The plans that currently existed, and those have not been used. So, my hope is that there'll be some type of celebrations. I don't know how big they will be, but the sooner we can get people vaccinated, the better.
Okay. Speaking of which, Mr. Webb, what's next regarding the vaccine? You're doing the Housing Authority this week, is that right?
Yes, we are. We're starting the Housing Authority on Friday. We're going to do 3 buildings, 280 Salem Street, 630 Salem Street, and Suffolk Manor.
Just for those residents?
Yes, just for those residents. And then we will do the remaining next week. As soon as we get a confirmation on our vaccine supply, we'll schedule those up. We're probably going to put those out to the Housing Authority administration staff so that they can do the homebound people first, and because that's a process, and then they'll register everyone else in those other, I believe, 5 buildings. I think we can do all 5 of those in a day. We'll test that theory Friday when we do the 3, with 630 being the largest. But we did 570 today, and it wasn't very difficult. So we're not going to come near those numbers for each one, any of those buildings. So I think we can easily get it done. I'd really like to get it done as soon as possible, so that we can lift the visitor, no visitor ban, and,
right.
and maybe not completely, but a variant thereof, have certain hours so that everybody in the building knows when there might be visitors in the building and they can act accordingly.
So, Mr. Webb, as for teachers, the state is directing them toward the mass vac sites in CVS, Walgreens?
Yeah, they have, and they've also added 4 days. I don't have the dates with me. I meant to get them before we came on, but there's 4 days in March. There's a Thursday, Friday, Saturday, and Sunday that they can go to any of the mass sites, and they'll be exclusive to teachers, which I think is going to be a huge thing. There's 400,000 teachers in this state, which is a shocking number. And a lot of them, I'd like to think, have been vaccinated. So those 4 days should really put a very big dent in that process. Yeah.
All right. Back to you, Mr. Cochran.
Okay, so yeah, we've covered a lot actually, but I do like to always bring it back to Malden, and I think you've addressed most of it. But we're sort of talking around it, and that is right now, I'm just a person sitting there. I'm waiting. I'm in that phase where maybe I'm phase 2, step 7. I'm sitting around, I'm waiting. What am I banking on for where I'm going to get my vaccine? Am I going to get it in Malden with you, Chris, or am I going to rely on,
Hospitals.
CVS's of the world?
You're going to rely on mass vaccination sites and retailers, CVS, Walgreens. I'm sure there'll be others that come along later. As long as they have a pharmacy and they have a medical supervisor, licensed medical supervisors, they'll probably, start shipping vaccine to those, like a Walmart, for example, someplace with a huge parking lot. That I could see changing. And I see they are definitely going to add more regional clinics that may have, local boards of health working in them, but there'll be a combined effort. And I think those clinics will really help out in the long run because they'll be in our communities, and people from the community will be working them. So I think that will make a big difference.
And as a follow-up, you recommend same pathway of going to mass.gov and going through their portal because it's going to list those retail as well as mass vaccination sites as well. Is that correct? Or do they go directly to?
No, I think you're right on the money there. The other thing I would recommend to people is, it's tough if you're not an early riser, but the best advice I keep getting is get online at around 6 o'clock in the morning. It's not as busy, believe it or not. You can drink your coffee and register. So you don't have to really be rushing. It seems everything after 9 o'clock, those sites get very busy and makes it very difficult to get registered.
Mr. Lanphere, let's say I was vaccinated and let's say they were vaccinated. Can I now hang out with them without wearing a mask?
So I think that, I think we want to stick with the CDC guidelines. CDC guidelines are really, these are not these are focused in the home. And, people that you've been living with and congregating with the whole time. These recommendations are not outside the home. They're not in the work environment. They're not in the bars. So I do think that for right now, I think we should just adhere to the public messaging that's going on that the CDC is putting out. But if there is confusion, I think there's a lot of people who think that everybody everybody at work has been vaccinated, and you don't know that. You also don't know your customers coming in have been vaccinated either. So, this is for the home, and I think that's where it starts. I think eventually it'll grow. I think with they're coming out with recommendations around travel, which I think will actually be quite interesting. Especially where states are in different phases of their vaccination programs. But for now, it should be in the home.
Okay. Mr. Lanphere, let me stay with you real quick. For Mr. Cochran and I, and actually the entire city, the hot topic right now is in-person learning. So do you see where the state's coming from with picking dates and times to return our students to the classroom?
I think we've had this conversation. Our pediatricians have had these conversations about, and with various groups about should we be returning kids to school. I do think that's something that's being left to the policymakers to sort of assess and make recommendations on. I still, I do think that, kids need to be back in school. I think it's hard to train, especially younger kids, over computers. I think, the one good thing is I think there's a different style of learning now that has emerged, especially when maybe, the winter weather is not so great. The kids may not get the luxury of delays in school or cancellations. And they, this method of learning is sort of going to take off. But, it's hard for me to sort of, weigh in on it as someone who's just not really involved with the school systems.
Okay, I know Mr. Webb has, and knock on wood, I have to say the teachers and the staff and the students have done a pretty good job so far. I think we're up to, we have pre-K through 2, We've had our high need students since October. Grades 3 and 4 are in on Monday, Chris. So makes sense to you?
I think, no, with the information that we have about the spread rate with the age groups we're talking about, I think we've got a pretty comprehensive approach. I like the work the school committee's done. I like the work the teachers union has done. I like the fact that they've been very open with each other and with me. That's been very, enlightening. I've enjoyed all those meetings. They're not always pleasant, but they're informative, right?
Yeah.
And everybody's looking out for one thing, and that is what's best for the kids. And I'm not an educator. I don't pretend to be, but for listening to them and hearing the details about what the kids are missing. I mean, my memory of school was not so much my report cards, but how much I enjoyed being there, right? And how important it was that I was there every day with my friends and doing all the things that I wanted to do and all the things that school had to offer. So I don't think there's any harm in going forward with the information that we have in a responsible, measured way. And again, if it proves that it can't be done, we know what we have to do. We just go back and, we try again another day. That's really, I don't think we're putting anybody at a higher risk. Let me put it that way.
Yeah. All right. Very good. Back to you, Mr.
so,
Cochran. Do you want to give that phone number?
Yeah,
one
sure
more time?
thing. If you do want, and I think the way we'll do this too, because I think studio is having a little problem. What happens is the folks that are at home can hear the caller. We can't, so we're having a technical difficulty on that. So my suggestion on that one, if you can hear us, studio, would be if you get calls that you could take those questions down with the name and relay them to us, and then we'll ask the question on behalf of the person. Unfortunately, we won't be able to do that live interaction for this particular meeting. Just to orient ourselves, we got about a little over 10 minutes left in this. We're on a hard deadline, a hard stop that we're trying to be respectful to with Malden Access Television. But the children that we mentioned in these schools, when will children be able to be vaccinated?
Mr. Lanphere.
So, I think to start out, to help people understand why children were not in the studies. There's a lot of ethical, protocols that go into place when anytime any testing goes on with pregnant women, children, and because these, the initial trials have done really well, we are vaccinating. They are now doing clinical trials on pregnant women and children. I believe so. Pfizer currently is down to the age of 16. Moderna is at 18. And Chris, you might recall what Johnson & Johnson is, but there are ongoing studies that are being done currently with, I believe children as young as 8. I think most of them are 12, but there's ones going on as young as children as young as 8. And I think as soon as those studies come out, I think that you will likely see, the FDA, assuming that those trials go well, you'll see the FDA approve that, and they will be probably, once we get most adults done, we'll be then reaching out and working with pediatricians and other family medicine programs to get children vaccinated. Their children are they're just a different animal given their age, their weight, and just their fear of needles and whatnot.
So, Mr. Webb, if we could vaccinate everyone today, there is an age limit. Is that what you're saying?
Yes, the youngest you could be vaccinated right now is 16.
Got it.
Depending on what you get. The Moderna is 16, Johnson & Johnson and Pfizer are 18. I think Johnson & Johnson will probably change. That will likely change. And they're doing the studies on that now. So that's optimistic too. If the other thing is, keep in mind, I don't want people to think that we were the first people talking about vaccinating children, because we're not. It's just, they can wait. They're just not spreading at the rate adults do. So it's important that we have this time to do these clinical trials, especially with pregnant women and young children. I think that from what I've read, they don't really want to go below 6 years old is vaccinating anyway, as of now, but that could change. So that this time that we have for these studies is a gift, and we should look at it that way. And whatever the recommendations come when they come, we'll take a look at it again, and if we're in agreement, we'll go forward. But I do think this time to study for the kids' sake is important, super important.
All right, back to you, Ron.
I'm not sure if it was mentioned before I was able to jump on the call, but I heard you talking about a big event. Were you referring to Easter? Because that was one of the questions that was asked, the holidays coming up.
Yep.
Yeah, okay. So we've covered.
It's worth repeating. So, Mr. Lanphere, those that are starting to talk about that, your advice is?
Well, I think we need to remember there's still more people in the population that have not been vaccinated than have been vaccinated. We still have, their lives are just as important as anyone else's. And so I still think that the measures we have in place need to remain until we get to the point where 70, 80% of the population is vaccinated.
And what percent is today vaccinated?
I believe we're at 10%.
10%.
I think that's where we're at the moment.
That was this morning, yeah, 10% this morning.
Mr. Webb, you agree?
Wholeheartedly, yeah.
Yeah.
It is great to have the thought that this is the time, but it's not.
Yeah.
We're not there yet. And I know we've got a lot of considerations around 4th of July, Easter, prom, dance recitals, which, I went through that, and it's important. Those are really important events in families' lives. But it's not good if those are going to become spreading events, because that's right now, that's what they would be.
Yeah.
There's no doubt about that. The hybrid models that most people are using, parades and distanced activities, while not optimal, have really turned out to be kind of a new way to be creative. And I'm always surprised with what people come to with plans and ideas. I can't remember, maybe one or two that I couldn't agree with. And I'm always impressed that people put the time in and they do their homework. And we need to keep doing that. It's not safe yet to be in large groups. I know Easter's a very big event in my family. We love the Easter egg hunt, but we won't be doing it. And it's hard to tell the kids. I mean, my kids are older, but they still want to do it.
Yeah.
So I know how important it is.
Right.
But I would caution that maybe this season is not going to be the one. Maybe next year will be that much closer. I think we'll be by spring of next year. I think you'll be able to, have hearty family gatherings. You'll be able to have more people in your home, visitors and the like. But people will have a better understanding of, because of where their health is at. Are they vaccinated once or twice? Have they gotten 2 weeks in? Have they had any exposures? Everybody's going to be well-versed, super well-versed by then. And hopefully people will take the protection of others more importantly than, a passing holiday. It is a passing holiday. There will be another, God willing, right? So hang in there, stay the course. Don't give up. Whatever you do, don't give up. I know a lot of people say, I'm done with this. I've said it. I've said it to myself. I don't like wearing a mask any more than anybody else. Believe me, that's why I grew this beard. I've never had a beard in my life. But stay the course, people. I can't say it enough, because going backwards really isn't an alternative.
We should end it there, Mr. Cochran. That's really well said. Are there any last minute questions, Ron?
Yeah, we can take a few more. I think we've got probably. Why don't we do just 2 more and then we'll wrap up?
Is it up? Okay.
Variants were talked about, so we've covered that. So that's actually one of them. For folks that are hesitant on vaccine, what efforts are we doing to educate our residents and especially those that English is not their first language?
Okay, Mr.
Great
Webb.
question. Thank you for asking it. I should have brought it up. We've been fortunate enough to be part of a 20-city campaign for outreach to the minority community. And luckily for Malden, we have an Office of Diversity. I met with a director today. She's incredible. she asked me to call her B. I can't pronounce her. I always get her last name. I say it wrong because I try to flourish it, but La Rochelle, I believe it is.
Yep.
And she's
Rochelle
incredible. We had a
Fibios.
nice hour-long conversation today. I'm so looking forward to working with her. She has a great understanding. Her background is impeccable for what she's going to be doing. She spent a lot of time in the trial courts, learning how to be, social work and do outreach and understand people's backgrounds. So I couldn't be more impressed, honestly. I'm so looking forward to working with her. We have a program where we'll have ambassadors out in the community. Hopefully we'll have a Spanish speaking and a Haitian speaking ambassador for certain neighborhoods, so we can reach those priorities, because we had not seen a lot of those people in our clinics. We're also doing a lot of work around the Arabic community. So starting Monday, we'll be putting flyers into all of the meal programs, and we have flyers up in posters up in restaurants. Supermarkets now. Restaurants will start on Monday. Stores will also be starting on Monday, where they'll have multiple languages. We have 6 languages, and people will be able to read these things and understand why it's important to be vaccinated. And if you have any questions, call us, and we'd be more than glad to have the conversation with you, regardless of the language you speak. We will find a way to communicate with you. We have translation services, but we just want to make sure that we're getting the marginalized part of the community in, and that's why we're going to be going to the Linden and Newland Street housing, because I think those are areas where we're not reaching, and historically we've never done a clinic down there, so it's time to change that pattern.
Great.
And B's going to really kind of help us steer the way. We're going to have a nice conversation, hopefully very soon, with the church community, and get a lot of outreach through that. That's always been successful. But, like I said to B, we're very concerned that we're missing somebody. I'd like to think that they're being vaccinated elsewhere, but until I know that for sure, we're going to pursue this, and, with a lot of vigor, to make sure that everybody feels confident that they're getting the best information and the best service, ultimately.
Okay. Christian, let me ask you, Ron Cochran used the word hesitancy. So someone gets COVID, they've recovered, they feel great. They're being told that they've developed, somewhat of an immunity. Why get the shot?
Well, I think, we've certainly had a fair number of people amongst our staff who have sort of expressed similar concerns. And our, first is, you can get COVID again. We have seen people get COVID several times.
Okay.
And this is, taking their own experience, it could be worse. In that really their best protection is to be vaccinated. But we also are trying to use campaigns of using people from similar cultures to talk up about their own experience getting vaccinated, so that they can hear directly from people that they can relate to about their experience, and reminding people that all groups and all cultures of people are being encouraged to get vaccinated, and that not just one group of people are being encouraged, and so that this really truly is a very safe campaign, very safe vaccine.
All right, very good. Well, on behalf of Mr. Webb, Mr. Lanphere, Mr. Cochran, and of course, the incomparable Uma, we want to say thank you for tuning in with us this evening. And as our guest said, hang in there. Do not give up. Stay focused. We're making progress. So we'll see you all again soon. If you have any questions, don't hesitate to reach out to us after the show. Good evening.